Good? All right. Hi, I'm Dr. Mike. On this week's episode of the Wellness Lab, we're going to be talking about headaches. Alright, so what we're going to be talking about today is headaches. And so headaches can stem from any number of things, typically stemming somewhere in the cervical spine, something going on in the neck itself. A lot of contributing factors or things that can affect headaches or actually make them worse are going to be a couple of things that we're going to talk about today. The first is going to be just a poor diet. So anytime we're talking about excessive alcohol or coffee consumption, artificial sugars, so anything in terms of sodas or drinks, anything that has like aspartame, sucralose, those are a couple big ones that tend to have an increased cause or increased incidence of headaches and migraines. Another one's going to be processed meats, bacons, hot dogs, and so in those we're looking at nitrites and nitrates. And so when you purchase these items, you can get them nitrite or nitrate free would be kind of the recommendation for that. Another big causative factor is going to be lack of water, so just basically being overly dehydrated. Most people tend to think that they drink enough during the course of the day, and what I typically challenge them to do is count how many ounces it is. The ideal number, the number we're looking for, is going to be half of our body weight in ounces. And so if you're not at that number, that's definitely kind of where you want to go to, what you want to attain to be. Last one is just going to be sleep. So basically sleeping positions or lack of sleep or just poor sleep in general. When we're talking about sleep, we're looking at a couple different factors with that. One is going to be sleeping position. So obviously sleeping on your stomach is going to be one of the worst positions to sleep in because it puts a big arch in your lower back, as well as you have your head turned one direction for the majority of the night. And so when that's the case, we're basically tightening one side, overstretching the other side, creating an imbalance from side to side. Next one's gonna be just a poor pillow. So if you're sleeping on your side, you can look at our other videos about sleep itself, but making sure that you're in a good neutral position, head basically lined up on top of the sternum. And then the other is gonna be the poor mattress. So bad mattress, old mattress, too broken in of a mattress, whatever it may be, it can also cause some increased stress, tension throughout the neck and through the upper back. Headaches, like I said before, typically stem from an issue within the cervical spine, and so when those joints get bound up, we get pressure on the nerves that creates eventually over time those symptoms that we talk about. A lot of people talk about, sinus headaches. Oh, I get headaches all the time. Oh, but they're just sinus-related headaches. Basically sinus pressure is going to make them worse. It's not typically going to cause them necessarily. So working with the neck, as well as talking about those dietary factors that we talked about earlier, that's really where we're going to see the best results dealing with the headaches stemming from the neck themselves. Coming up next, we're going to take a quick break here, and then it'll be Raney's Fitbit.
Hi, I'm Raney. Welcome to the Fitbit of the Week. This week we're talking about headaches. So I wanted to share with you something that I use personally. This is called the Neck King. I just bought this online. So what this is kind of like trigger point therapy. I get tension headaches a lot where my shoulders and my neck really get tense, and then it causes me to have a really bad headache. So what this is doing is these knobs here on the top are pressing into your occipital region, which is right at the base of your skull, where I get very, very tense, and it's helping release that tension. Obviously, the best way to release the tension would be to get a massage, but not all of us can get a massage every day or, right then when that headache occurs. So I found this to be very helpful. So I'll kind of show you how to work it. It does come with like a little pamphlet on how to use it. And not only it can be used for your neck, but it can also be used down your back too. But I just typically use it for my neck. So you'll notice here that there are 4 bumps on the top, and there are some that are a little lower than the others. So the lower bumps are the ones that are closer to your shoulders. So I'm just gonna lay this here on the ground, and then you just lay on top of it. So I'm gonna place my neck right about so that the top bumps are pressing right into there at the base of my skull. You can kind of wiggle your head around, move it to the side, or just, laying there still. I do feel a lot of pressure there, because it is tense now, I guess, also. But just like that. If it is very hard plastic, and so these do hurt a little bit, especially if you're very tense. So if you need a little cushion, you can place like a folded towel over it to just provide a little padding, so it doesn't hurt quite as bad. But like I said, I purchased this online for about $30. You can kind of just Google the Neck King, and they're sold on several websites. But I typically use it for about 5 minutes or so, depending on how long you can take the pressure of it pushing into that area that's bothering you. But yeah, so that's been this week's Fitbit, and we'll see you next time.
Welcome back. What we're going to be going over now is we're going to go over my assessment and then an adjustment for cervical issues that are contributing to or causing some headache issues. And I've got my lovely assistant Raney here with me today. And so Raney is a current patient of mine. So in her case, I've gone through and done a history, an examination, a full chiropractic exam on her already. So normally that would be kind of first step. Her already being a patient, we're just going to go through and talk about kind of my basic assessment for a neck or cervical type adjustment. So if I could have you lay face up on the table for me. And so when I'm checking motion within the spine, what I'm doing is I'm basically putting my hands on both sides of her neck, and I'm just feeling motion in both directions. I'm looking to see, is it moving equally from left to right? When it comes to where it's not, that's what we term or deem a subluxation. So that subluxation is that cervical issue or that spinal issue that's causing some nerve pressure that's eventually going to be leading to some symptomatic stuff or functional stuff going forward in the future. So up at the very top here is where we're going to work, and so I'm going to bring her to the side, just give her a little push. Recheck that spot to make sure it's moving as it should be. One more position here we're going to work. There we go. So a question that we get quite often is what is a subluxation? We talked about it in one of the previous parts of our video today, just basically the term subluxation. Subluxation simply means less than a dislocation. So a dislocation is a joint fully out of its socket, fully out of joint. Subluxation simply just means less than that. And so when we're looking at joint motion and joint alignment within the spine, a slight aberration of movement or misposition or malposition can cause pressure on those nerves, causes some inflammation, swelling, muscle tension. Eventually over time, that leads into symptoms. What we're really looking at is the functional side of things. So if we get the body functioning better, we're therefore going to feel better and have less symptoms as a result of that. For more information, you can head over to our website at WellnessLab.tv.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram. Or check out our show website at WellnessLab.tv.